Many parts of the world are currently seeing what could be a second wave of COVID-19 infections. Experts point to the easing of restrictions in many countries as the reason. Our Seung-jae explains.
It's what many feared. A second wave of COVID-19 may be sweeping across numerous countries.
The current uptick in cases in some countries can be represented, yes, as a second wave or a second peak.
While countries like Brazil are still struggling to contain the first wave, other countries are already seeing a significant uptick in new infections. In the U.S., more than 20 states are now seeing more infections. These include Arizona, Texas, and California. Many health experts point to the easing of restrictions and the Memorial Day weekend last month as reasons behind the spike. A second wave is also affecting India, which after easing its lockdown is now seeing a huge surge and currently has the fourth most infections in the world. Iran, which saw its infection numbers dip after being one of the worst hit countries in the world, is now seeing a second wave with more than 2,000 cases a day. China is seeing new infections pop up in Beijing. The Chinese capital has seen over 50 new cases in less than a week. While many cite the easing of restrictions and lockdowns, others believe the virus may have mutated. Researchers in Florida says the virus is mutating in a way that makes it easier to attack human cells. However, the WHO says mutations seen so far would not affect the efficacy of vaccines currently being developed. Experts say in a world without a vaccine, a second wave could potentially be worse than the initial one. Seung-jae, Arirang News.